Hi, everyone, and welcome to episode 87 of the Pet Behavior Chat. And I'm super, super excited to be joined by a colleague, but also a friend today. And that is Dr. Carrie Tooley from the UK. And I have to tell you a quick story before we get started with the episode. And that is that Carrie and I have recently just sat our board exams together for the European college exams. So we've just had a bit of a shared trauma together, which I think always kind of binds together.
Yeah.
Yeah. So I'm so excited to be chatting to Carrie today. And Carrie has looked into the importance of sleep in our pets quite a lot. So that's going to be our topic today. So welcome, Carrie. But before we get started, do you want to just kind of chat us through a little bit like your professional career history and what's brought you to this point?
Yeah, absolutely. Thank you very much for inviting me to come and chat. I've been looking forward to it. So I qualified as a vet in 2012 with very, very little behaviour education at all to speak of. Didn't really realise that being in behavioural medicine was a pathway that I could have taken at that point. And went into general practice, mixed general practice, so probably about half farm, half smallies, and really enjoyed that for a fair while. But became more and more nerdy for various different reasons about behaviour and what motivates animals to behave in the way that they do. And 3 years after qualifying, I started to do the clinical animal behaviour masters at Lincoln, and I also started working in effectively an internship sort of position at a practice called Behavioural Referrals Veterinary Practice, where Sarah Heath is the head vet. Fast forward about 10 years or so, and I'm still there. We've, as you just said, sort of completed our residency, so we're now specialists in behavioural medicine. And throughout those 10 years, I feel like I've learned so much from a practical perspective through doing the residency and working at the practice, but also from a theoretical perspective with the masters. And one of the biggest things that sort of drove me towards the sleep aspect of things is the focus at behavioural referrals is using an approach called the Heath model developed by Sarah Heath that has a real emphasis on incorporating the role of emotional arousal when we're looking at behavioural problems. And when we start thinking about emotional arousal, so what I mean by that is how much emotion is being experienced by the individual. So yes, we look into the specifics of which emotions are relevant, but from an emotional arousal point of view, we're looking at how much emotion and the capacity for managing that arousal. When we started to really focus on what controls that, sleep was very, very high up the list. So you've got some behaviors that are species specific that can help moderate arousal. So for dogs, they enjoy licking and chewing. Activities to lower arousal. Cats will do a lot of their self-grooming to moderate emotional arousal. But above and beyond those, by a long shot, is sleep and good quality sleep and rest. And that's what really drove me down being a bit more of a sleep nerd and trying to work out all of the ins and outs of the details of sleep. So sort of how much sleep should these animals be having? Is it actually about duration or is it more about the quality of that sleep? And yeah, that's what's motivated the research that I did from a residency, and quite a bit more study sort of beyond that that's ongoing.
That is so interesting. I mean, we know just from ourselves how important sleep is, whether, like you say, it's duration or it's quality. So, of course, it makes perfect sense that that's something that we should also be looking at in our pets. Can you define a little bit more what you mean about quality of sleep? And I mean, duration sort of obviously makes sense, how many hours do you sleep? But there's quite a big difference between our pets and us, for example, in terms of how much sleep we need. So do you want to dive into that a little bit more?
Yeah, absolutely. So I think let's start with duration because I think that's one of the biggest misunderstandings, possibly more with canine pets than it is with feline. I think most cat caregivers have a pretty good understanding that their cat is going to be napping a lot of the day as well as quite a bit of the night and potentially being awake a little bit in the dawn dusk times as well. So feline caregivers tend to have a pretty good understanding that their pets' sleep patterns are quite different to ours. But I certainly find coming across a lot of our dog caregivers that we work with, there's a real misunderstanding about how that species live with us and how much sleep they do need. So we have a lot of caregivers that inadvertently deprive their dogs of sleep, and it's with really good intention, but they'll be worried that their dog is bored, for example, so we'll wake them up and play with them, or wake them up and take them for a walk. And those activities are not traumatic, they're not stressing their dogs by doing so, but in the same way with us, if we were partying half the night instead of sleeping, it does have longer term repercussions for sure, and we tend to get behavioral problems. And I think compounding that in the UK especially, we've got this real myth that if you've got a badly behaved dog, you just need to exercise it more, it's understimulated, and you get people recommending increased activity and increased alertness. And actually, a lot of these times, these dogs just need appropriate opportunities for downtime, and that'll really improve their behavior and their emotional health. So we believe that emotionally healthy dogs sort of sleep in the region of 14 to 18 hours in a given 24-hour period. So they really should be napping for good chunks of the time that we as humans are awake. And I think that this is probably also be compounded by lockdown and the sort of shift in working patterns in the UK. So we certainly saw pre-lockdown a lot of dogs were left on their own for maybe 6 or more hours a day whilst caregivers went out to work. They might have been walked at lunchtime, but then another chunk of time on their own in the afternoon. And lockdown occurred and people thought, oh, it's going to be brilliant, we're at home with the dogs, they've got way more company. And a lot of these dogs did not cope well because, as I say, it wasn't a stressful event having their caregiver around, but it was exciting. It was more interesting than the time that they spent when they were on their own, and therefore they chose not to sleep. And we created this sort of population of really quite sleep deprived dogs, and especially the pups that were born into lockdown. So that 14 to 18 hours is thought to be appropriate for adults, but pups is probably up near 20 hours a day that they should be spending asleep. So these lockdown puppies that were effectively bought to entertain the kids in the household did not get to the sleep that they needed. And that's created probably quite lifelong emotional difficulties for a lot of those individuals. And those emotional difficulties, I think we often think about sort of fear, anxiety type issues, but I think a lot of the problem is actually just emotional regulation. So it can be that they get very excited about stuff, but they don't cope well with the level of excitement that they have because their emotional regulation is quite poor. So that's probably the sort of duration aspect of things. Then when we think about the sleep quality aspect of things, we know that with pretty much all mammals, as far as we're aware, there's probably exceptions for your aquatic mammals, so sort of whales and that sort of thing, which can sleep with one half of their brain at the time, which is just a whole nother level of fascination. Yep. But we probably won't dive into that because it's not too relevant to most of our listeners probably. But yeah, so for most of our sort of common mammals and certainly common pets, they go through very similar sleep cycles from a point of view of the structure of the sleep cycles that they go through compared to humans, but the duration is different. So for cats, we believe their sleep cycles is somewhere in the region of about half an hour. For dogs, there's some studies that say 20 minutes. That's sort of where I err towards. There's other studies that say 40 minutes. But I do wonder if we're sort of missing a mini micro awakening in the halfway point of that. But otherwise, so humans, for comparison, the sleep cycle is 90 minutes. And what that means is you go through your slow wave sleep phases and go through REM sleep, so your rapid eye movement or paradoxical sleep, it's sometimes referred to as. And then you have a mini micro awakening that you might not even be aware of, but it's your ability to become slightly more conscious, check whether there's any threats in the environment, and then go straight back to sleep if everything's okay. And that sleep quality is making sure that we basically go through those cycles, able to get into the latter stages of the cycle rather than sleeping in too vigilant a state to allow you to go into the latter phases. And the reason why, in particular for behavioral medicine, that the latter phases is so important is because REM sleep is the phase where most of the emotional processing of your day occurs. So the experiences that you've had during the day, from a cognitive perspective, your memory laydown and your factual sort of memory occurs in the non-REM sleep, but your emotional processing of the day occurs in the REM sleep. So if we have individuals that are not going through those full sleep cycles and are in particular being robbed of REM sleep, they are often very, very emotionally compromised. So that's a real focus of the work that we do.
Wow. Oh my God. I mean, there's so much to sort of unpack here. And I love listening to you, sort of the way that you're kind of explaining it, because I feel we all know how important sleep is, but getting into that real sort of nitty gritty of it, the sleep cycles and that emotional processing in those latter stages of the sleep cycles and how important that is. I mean, that's just incredible. What do you think that means kind of from a practical point of view? We've got listeners who are both pet caregivers, but we'll also have listeners who are veterinary professionals or pet care professionals that might be also working in hospitals where they've got inpatients that are overnight patients, that are convalescing patients. What do you think some of the practical implications are for both caregivers and professionals?
Yeah, I think I'll jump on that impatience one to start with, but then come onto the sort of more day to day. I recently went to so a lot of the CPD in sleep, in fact, pretty much all of the CPD in sleep is human, so it's as in directed towards human sleep assessments and human sleep treatment. And I'm trying to sort of do my best to attend that and then sort of extrapolate back towards what's going to be useful for our patients. But one of the days I recently attended at the Royal Society of Medicine was specifically a whole day on inpatient sleep because it's such a problem in human healthcare. I mean, we know that sleep is essential for healing. It's essential for the repair of the body. Excuse me. The sort of replenishment of our reserves and all of that sort of thing. And then we have individuals that are in the most need of replenishment and repair, being inpatients, and then also being sleep deprived as a result of being inpatient. So it's a huge focus in human healthcare. And one of my sort of slightly more humorous take homes from the day was I have never spent so long chatting about bins and how loud bins are. So that's one of the biggest things in human healthcare that wakes people up is the bin lids shutting in the wards, because it's quite a sort of metallic clang that's very alien to most of our sort of psyches. So people wake up really frequently as soon as anything's put in the bin. But it's those sort of considerations which we need to think of for inpatients. So in particular for our inpatients, I think, yes, noise is a big part of it. Can we minimize noise where possible? Can we think about our lighting in particular at night time, but sort of throughout the day as well, sort of making sure that patients, if they like being in a sunbeam, fine. So some of our feline patients in particular will benefit from that, but a lot of the time actually slightly dimmer light might be more optimal. I also really try, and it's probably more a first opinion thing than potentially in referral, just depending on the patient caseload. But often in first opinion, we will have patients that maybe are inappetent and we're trying really hard to encourage them to eat. So we're warming up some wet food, we're making the sort of smelliest possible, sort of most enticing food. And we've got that patient maybe next to an ill by mouth patient that's waiting to go ahead with surgery. And that's just going to cause a whole host of frustration between those sort of two different needs and the scent transfer between the two. So I quite often chat to people about just sort of little practical measures of, if your nil by mouth patient is also due to go out for a toilet break at some stage, try and coincide that with when the smelliest of the foods are around, so that they're just not in that environment. So tiny little tweaks to the sort of inpatient care can sometimes make quite a big difference. Little things like, again, having a towel across the front of a dog's kennel if that dog is really sociable and can see the other dogs and wants to interact with them, and again is potentially getting themselves a little bit frustrated, or just that option to have visual and communication going. Actually, if we can shut off that option, they may choose to sleep and rest instead. So just little management tools like that can be really helpful with inpatients, I think. And then coming on to the sort of more day to day, and in particular at home, I think one of the biggest things is I've sort of borrowed the phrase from the human healthcare side of sleep hygiene. So thinking about actually what the optimal sleep conditions are for any of our pets. And sometimes that can be generic. So you can sort of say, well, cats like higher temperatures. So in particular in the UK in the winter, we need to be thinking about access to radiators and sort of hammock beds and that sort of thing, or particular sort of warm areas of the house to ensure they've got access to. So some can be quite generic, but a lot of the time I think we need to listen to the individual. So some individuals will really like human company when they sleep, but need that human company to be quite calm. Other individuals, especially if there's kids in the house, probably need a bit of space away from the family in order to switch off and sleep. As we all would. Like, I wouldn't be able to sleep with a toddler doing toddler things, sort of running around the room. So yeah, absolutely making sure that they've got the sort of social environment that they need in order to be able to sleep, and make sure they've got free and easy access to that from their perspective all of the time. Thinking about temperature again, especially for older patients, so that's relevant for dogs as well as for cats. So if they are beginning to get a little bit of arthritis and sort of joint pain, temperature makes a big difference to how comfortable those individuals are. And then where are they choosing, or what surfaces are they choosing to lie on, and try and work out why that might be the case. So some people will say, oh yeah, he'll sleep on my bed really happily during the day. Great, okay. But if that's the most comfortable resting place you've got, do they have access to it when you're in the bed? And if not, can we mimic the same level of comfort in another bed? So maybe getting them a really big, really wide orthopedic bed if you've got space for that in the house if needs be. So thinking about those sort of environmental aspects as well as the social aspects of sleep is really important. And I think I rarely chat about sort of beds and sort of surfaces and that sort of thing without also thinking about traction. So it's not just about the bed, it's about the ability to get on and off that bed as well. Because if you've got the world's most expensive, beautiful, perfect orthopedic bed, but it's on a laminate floor, and your slightly arthritic dog struggles to get on and off it, they're not going to use it, no matter how well thought out the actual bed itself is. So thinking about that access is really, really important for sure. And then I think also just our interactions. So in particular with working line dogs, they are hardwired to respond to our cues. So making sure that we don't do that absolutely natural, caring human thing of wandering through a room and just having a brief chat to our dog if they are already asleep or resting. Just let them be, let them know that there is no interaction available at those times, or there's no interaction that they need to pay attention to at those times. And certainly the cute ones you want to go past and just have a little fondle as you go past. And again, it's making sure that if the dog is at rest, I tend to say basically if they've chosen to go to their rest space, just keep hands off, keep interactions to a minimum. They will come to you when they want to interact. So it's making sure that we respect those times when they have chosen to take themselves off and rest to promote that, for sure. There was something else that you mentioned. There was 3 things out of your question that I wanted to come back to. Impatience was one. That was the second one. Don't worry, it'll come back to me. The last one will come back to me.
One thing that's just popped into my mind that we could perhaps elaborate on a little bit more is maybe pain. And the reason it's just popped into my mind as you were talking there is because a few years ago, I had quite bad sort of back pain. I had like some musculoskeletal pain, and it was specific to sort of my lower back and hip area, and it really affected my sleep. And even now, on occasion, if I've gone to the gym and I'm quite sore, it will really play havoc with my sleep. So especially when we're thinking about those sort of older arthritic dogs, you mentioned the bed, but that whole pain management piece, or, management of pain and discomfort, whether it's musculoskeletal, osteoarthritic, or any other type of pain or discomfort, surely that's got to be a big piece.
Yeah, for sure, definitely. And I think sometimes when we're looking at cases where the sleep isn't ideal and isn't great, if they are already on pain medication, even just looking at the timings of that pain medication can be really useful. So I know some of the top analgesia specialists absolutely take into account, okay, when are we giving this in relation to when the dog's exercising? When are we doing this in relation to when the dog's doing or cat's doing their physiotherapy exercises? And also, when are we doing this in relation to when they need their biggest chunks of sleep? Because absolutely, if you have discomfort, trying to get to sleep is really hard. And also, when we're thinking about these micro awakenings where the subconscious goes, are there any threats? Is everything okay? Actually, if you're in discomfort, then the answer is no, you will wake up fully and then you're more alert to what's going on. So yeah, absolutely, really, really important that we've got pain control really optimal, in particular for times of sleep. And like with any sort of pain management and pain detection, if you like, for caregivers, often the behavioral changes are the first thing that you notice. It's rarely sort of, unless it's an acute issue, but for chronic pain episodes or for things like osteoarthritis, which gradually creep in, usually it's behavior change rather than an overt limp that we notice as one of the first signs. And I would add changes or sleep disruption to those sort of behavioural signs as a bit of a flag. And then you've got to consider, and this is sort of one of the things that I've chatted about with quite a few analgesia specialists, is the reciprocal argument as well of, if you are not sleeping well, your emotional health is more compromised, you have less tolerance for emotional arousal, but you're also more pain sensitive as well. So if you do have an individual that hasn't got the opportunity to have decent sleep, they are going to be more sensitive to a potentially what would otherwise be a minor lesion in an individual that's getting really good sleep and has really good emotional health. Because as soon as emotional compromise occurs, the sensitivity to pain increases significantly. And that's why we can't sort of look at a lesion and say this is the pain protocol that that individual should have. We've got to look at that individual's perception of the lesion in order to tailor our pain management to that, for sure. So yeah, it's that reciprocal aspect of that relationship that we need to take into account.
That's so cool. I mean, and especially what I love is that whole idea of tailoring the analgesic protocol around activities, but not just around activities, also around that need for sleep. So, you know, what does that look like at night, for example? So yeah, I love all that. That's amazing. So why don't we move on to your studies? So you've done a couple of studies, one case report and one piece of original research looking at sleep. Should we have a chat through the original research, which I believe was looking at so caregiver reported problem behaviors and how that correlated with their sleep characteristics. Do you want to chat us through that a little bit?
Yeah, absolutely. So, I mean, background is basically all the stuff that we've been chatting about already from a point of view of what motivated me to look into this. And then we basically wanted to just get a bit of a starting point. So this is not research where we could sort of pull out really detailed in sort of relationships between specific problem behaviors and specific sleep issues, because there really hasn't been anything from a clinical perspective that at this stage when we published this that sort of looked into this sort of thing. So it was going to be quite a basic look, but hopefully with quite a big cohort, as it turned out. So we got over 1,400 respondents, so relating to 1,400 dogs, I should say. So some of those might have been one caregiver reporting on 2 dogs. But yeah, relating to 1,400 dogs. So we had a really, really decent sized cohort. I quite often say, if you want decent cohort studies on questionnaire basis, try and do it during a pandemic. You get quite good responses where people are bored at home. So that worked well for us. It was, disruptive to a lot of research, but I think we hit a sweet spot at the pandemic when we needed the questionnaires coming back in. But yeah, we wanted to basically look at what do caregivers recognize as sleep. So we sort of had a bit of a few questions on what characteristics dogs show that the caregivers recognize as them being asleep. So things like quite basic things like sort of having their eyes shut, breathing more slowly, staying still, but also sort of looking into how many people see twitching and vocalizing as though the dogs are dreaming. So that's sort of what we assume is REM sleep behavior in dogs, looking at muscle tone and that sort of thing. And generally speaking, most of those things were sort of reported by the majority of caregivers. Snoring was interesting. So that came back with, I think, something like sort of just under 60% of respondents saying that their dogs snore. So I know when we chat to Claire Rushbridge, she's definitely an advocate for dogs should not be snoring. They are obligate nasal breathers, and they absolutely need to be in a position where they can breathe through their nose easily. And there's a lot of research in human sleep medicine about OSA, so obstructive sleep apnea, and the fact that snoring is really sort of a big sort of risk factor for that obstructive sleep apnea, and the problems that occur when there's insufficient oxygen basically during sleep. So real sort of welfare implications for our brachycephalics in particular, when we're thinking about actually how difficult they find it when we look at the positions that they have to get into. So often they're sort of resting their chin on something or lying in dorsal and stretching out that throat to really try and get enough air in to just stay asleep healthily. So yeah, real welfare implications for the brachys in particular. And then sort of some of the interesting sort of caregiver observations where we asked a question about, is your dog unresponsive to stimuli that would typically cause excitement? And actually only, I think it was less than 40% of caregivers reported that that was one of the signs of sleep, which for me implies that we've probably got quite a lot of dogs which maybe aren't sleeping sort of quite as soundly as we would like them to, certainly during the day. Because for me, I think if you've got a dog in a decent level of sleep, yes, if there's a loud noise that would cause excitement, absolutely they should wake up. But if it's something like the fridge door opening, I would hope that, and maybe especially in a different room, I would hope that they could potentially sleep through that. But yeah, depends on their motivations, depends on their bias, depends on their hearing. So there's a lot of different stuff that goes into that. But yeah, I was a little bit sort of maybe concerned, maybe sort of motivated to look into it further in the future, that only 40% or less than 40% of dogs are unresponsive to stimuli that would otherwise cause excitement when they're asleep. So that was the observation aspects of it. We also, the main sort of things that we looked into was basically trying to establish whether there is a relationship between the duration of sleep that a dog achieves and the sort of severity of problem behavior. Now, as I say, it's a sort of exploratory study, if you like. So it's the measures of sort of severity of problem behavior were fairly crude, and that's an absolutely valid critique that can be leveled at this research. But basically what we did is said to caregivers, if you had to score how problematic your dog's behavior is on a scale of 0 to 100, what score would you give it? So 0 is my dog is absolutely perfect, there's nothing wrong with it at all, and 100 is I can't deal with this dog's behavior. So that was the score that we asked people to give. And then we correlated that with how much sleep their dogs were getting. And we split that into sleep duration whilst the caregiver was in bed and sleep duration whilst the caregiver was out of bed, because we were interested in that sort of social aspect. And from a point of view of the sleep duration whilst the caregiver was in bed, we found the optimal duration of sleep was about sort of 6 to 8 hours. So if dogs were getting, the less sleep they got sort of from that point, so 6 to 8 hours, they would have worsening behaviors. If they got 4 to 6 hours, they would get worsening behaviors still if they got only 2 hours, for example. So there was a sort of real curve towards worsening behavior scores the less sleep that they got. What was interesting is beyond 10 hours of sleep, we also saw a slight increase in problematic behaviors. Now, given that that's sleep duration whilst the caregiver is in bed, we then have to assume that the caregiver themselves are in bed for beyond 10 hours or beyond 12 hours when we're starting to see these increases in scores. And as I say, we didn't look into the detail of what those problem behaviours were, but it could be pestering the caregiver, trying to wake them up, wanting to go outside. It could have been house soiling. So there are some potential explanations for that, but we haven't got the data that sort of delved into the reasons of it. But the general pattern was the less sleep they get, the more problematic their behavior scores, until the point where we get this optimal at about 6 to 8 hours. And then beyond that, there's a little kick up where there's an increase in problem behavior score. So that's whilst the caregivers are in bed. Whilst the caregivers are out of bed, it was much more of a linear relationship. So the more sleep the dog got, the better their problem, so the less problem behaviours or less severe problem behaviours they showed. And that, to me, makes a lot of sense, both from a sleep health point of view, but also if your dog is asleep, it's unlikely to be showing any problem behaviours. So there's a sort of practical aspect to it as well. But what was quite interesting is when we did more of a statistical analysis, we incorporated some of the questions that we had asked about ease of disturbance, so how easily the dog wakes up. And actually, when we looked at that linear relationship, so the severity of problem behaviours whilst the caregivers are out of bed, that was better explained by how easily the dogs were roused from sleep than it was by actually just the duration when we looked at the stats. So basically, there's an underlying common reason, we believe, for rousing easily and therefore not getting a good duration of sleep whilst caregivers are awake. And that could be twofold. So I tend to, when I'm thinking about dogs that aren't sleeping well, I split them into two main categories. One is dogs that have optimal or at least very adequate sleep environment, but there is something intrinsic that doesn't allow them to make the most of that. So that could be an emotional disorder, it could be physical health issues like we've already talked about, or we've got the other side of things where actually we've got a physically, cognitively and emotionally healthy dog, but their environment is suboptimal, and that could be very, like we said, well-intentioned caregivers thinking that they're bored and waking them up frequently. So it doesn't have to be that it's an unresolvable environmental problem, but if we've got a physically, emotionally and cognitively healthy dog that's in an environment where they can't sleep, then we need to address that environment.
Yeah, no, absolutely, that sounds incredible. I mean, such interesting research and such really valuable, from. Should we chat about your case report before we move on to some of the practical pieces? Because I know you did a case report on a doggy that was fly snapping.
Yeah, that's right. So he was originally referred to a neurology service for fly snapping behaviour, and the details of it will be in the study. So as we were just chatting before we came on, saying this is a few years ago that we put this report out. So the details of it are all in the study if anyone wants to have it, or in the report if anyone wants to have a look through it. Just search Tooley, or do you pop notes on for the, yeah, perfect, lovely, so it'll be in the podcast notes.
Exactly.
Perfect, ideal. So yeah, we'll pop it in there. So if you want the detail of the sort of chronology of the case, the treatment that he had been on before I saw him and all of that sort of stuff, you're very, very welcome to delve into that study. But basically with him, he was a really interesting little boy. He was 7 months old, so quite a youngster when I met him. Lived in a household with two older dogs, so I think a 10-year-old and a 13-year-old. He was a working lines Cocker Spaniel, and very, very in tune with caregiver movements, caregiver interactions. So would pay a huge amount of attention to caregivers if they were available in the room with him. And found it very, very difficult to switch off from anything that they did. So Mrs. could be, say, for example, working at a laptop, but even if she just moved to reach to get a coffee, for example, he was alert to that sort of movement. So he was really not able to kind of switch off from when a cue might be available that might tell him something more exciting was happening. And generally speaking, he wasn't the sort of boy that most individuals, or most sort of untrained or sort of non-behavioral medicine individuals would have said had many behavioral issues other than the fly snapping, because actually most of what he wanted to do was very quite appropriate, sort of quite optimistic looking behaviors. So he would want to play, he would want to go and do spaniel things out in the garden and get his nose down and sort of start tracking for scents and stuff like that. And he was a fun individual to be around. So he didn't have the sort of typical maybe confrontational behaviors or the sort of classic behavioral problems that people glance at and go, that's a problem dog, because he looked quite fun. But he was doing all of those fun activities for a huge proportion of his day. And then when downtime was expected of him, he would show this sort of fly snapping behavior. And it was at a stage where it would have been described as compulsive. He struggled to be broken out of it. He would go back to it really quite quickly. And as part of the treatment plan that we instigated for him, and it was by no means a whole treatment plan, but it was a really significant part, was basically just ensuring he got adequate downtime during the day as well as overnight. So he was already crate trained. He was very, very settled, very happy to be verbally cued into his crate. He would quite happily settle in there overnight. He would quite happily settle in there. I think when the caregivers were away from the home, they often crated him. So we knew that he had a good perception of his crate. He didn't have any issues with that. So we instigated a little bit like you would with a toddler, just some nap times during the day. So we had not necessarily a strict schedule, but a real aim to achieve sort of 4 hours of napping across the day. So whether that was a block in the morning and a block in the afternoon, or whether that was sort of 4 1-hour blocks, just depending on the routine, but making sure that he got a chunk of downtime during the day. And that significantly improved the fly snapping behavior, with to be honest, probably very little else that was making a significant difference in my opinion. Difficult to tell because there were a few other things that we did do, so it may have been the combination of everything. But I feel like that was a real turning point when we instigated the structured downtime for him. And why the fly snapping occurs when dogs are sleep deprived, or in this case, why dogs are sleep deprived, is not well established. So we don't know for certain. And we've had quite a few sort of interesting chats that, from a neurology perspective and from a multidisciplinary rounds perspective. One interesting suggestion that I sort of hadn't considered until one of the neurologists brought it up was in human sleep deprivation. There are studies, or sort of like there's quite a lot in the military about human sleep deprivation from a point of view of obviously the conditions that working soldiers go through. But one stage that humans tend to get to is a hallucinating stage where you sort of see sort of either lights shining or you see sort of movement of things in your peripheries. And actually, if a dog did see that, would we not expect them to try and catch them? So it was just I don't know for sure at all that was what was going on, but it was a really interesting thought that I actually hadn't come to myself until we had those discussions. There are lots of other suggestions as well, for sure, but it was just, one of the slightly more niche ones that I went, you know what, that would be really hard to disprove. So anything that I can't disprove goes into my sort of bank of maybe that could be occurring. But I just thought that was a really interesting suggestion.
Yeah. Thank you so much for sharing that. I always learn so much better, like by listening to cases and thinking about cases. So that's such a great case to think about. And so finally, from a practical point of view, so you mentioned with this little guy, you try to build in chunks of downtime. So whether that was a couple of longer chunks or more sort of chunks. How practically do you do that? How do you actually teach downtime, and how do you build that into an everyday scenario?
Yeah, good question. And I think it depends on the patient. So for him, actually, as soon as we gave him a clear cue that there was no interaction available, i.e., you're in your crate or in a separate room and no one's going to come and disturb you, he instantly chose to go to sleep. So with some of our cases, they almost seem to know that that's what they need, or they will prioritize that at least when they have the conditions available to them. So a lot of the time it is just looking at the patient, looking at the environment, looking at what's happening day to day, and especially during caregiver waking hours, of what is this patient doing when we should be expecting them to sleep? So what are the activities that they're engaging with? And if we have a patient where they are doing a lot of play, they're doing a lot of pestering of the caregiver, they maybe have the only bed in the kitchen, and there's teenagers in the house and everyone's eating at different times, and every time the fridge door opens they're like, "Bling, can I have some cheese please?" So any of those things, if it's obvious what they're doing instead of sleeping, and you can just remove that stimulus from the environment, if they are physically and emotionally and cognitively healthy, they probably will choose to sleep instead. So sometimes it is just a case of observing hour to hour and then removing some of those stimuli. So it could be that if the only bed available is in the kitchen, actually having a bit of a rethink about where we put that, because at many houses the kitchen is the hub of activity, I think, a lot of the time. So it's looking at those aspects and trying to work out what the dog's doing instead, or the cat. Cats in particular, I think, are interesting. So often we'll see them just being quietly vigilant, and actually we sort of watch them looking out of a window, for example, and we don't perceive that they're distressed. They don't look distressed, but actually if that window and the potential either a threat outside, so there's another cat moving around outside and that's what they're really vigilant to, or one of my amazing cases from a couple of years ago was a cat that got what seemed to be seasonal cystitis, and we were going, interesting, what's going on here? So every spring this cat would have pretty bad cystitis, and went to do an assessment. She was an interesting girl, so she would choose to play an awful lot of her time. So one of the examples that they gave was they had like a little mezzanine level in their apartment, and she would run up the stairs, throw a toy down the stairs for herself to chase, catch it, carry it back up the stairs, and just repeat that on a bit of a loop. So she was definitely motivated by her desire seeking system, for sure. And then when we established what was happening during the spring is at times when she would otherwise be napping, she took herself to the kitchen windowsill because there was a nest box on the wall outside the kitchen windowsill, and she would watch for the fledglings being coming out of the nest box. And that directly correlated each year with when she had her cystitis episodes. So we basically put a bit of temporary frosting on the kitchen window. Wasn't an option to remove the nest box because it was a rented home. So yeah, temporary frosting on the kitchen window to prevent her having that option. And she just chose to sleep instead, and that sort of resolved the cystitis sign. So I think that's another thing from a kind of GP vet point of view, especially when we're in first opinion, because it's difficult to know when you should have conversations about sleep. I would certainly say if you've got puppies and kittens coming in, absolutely a good time to have conversations about sleep. So get people aware that their pups need about 20 hours sleep a day. Get people aware that the adult dogs need sort of 16 to 18 hours sleep a day if possible. Just manage those expectations and create good downtime. But yeah, certainly the other sort of red flag where I would start to discuss downtime and sleep is if you're getting recurrent conditions that could have a stress component or a kind of cortisol related component. So your cystitis is recurrent respiratory conditions in cats if they're not clearing up when you'd otherwise expect them to, chronic diarrhea in dogs, all of that sort of stuff. Have a chat about downtime, because if we do have too much emotional arousal, that's another aspect. Is those chronic health conditions that we can flag that from a first opinion veterinary point of view.
That's so amazing. So my final question was going to be, what are some practical suggestions? But I think you've actually already given us so many practical suggestions right from when we started. Can you remember the question, the other thing you wanted to say about my initial question, where we've
come on to it? I think I think we've covered it since we sort of looped back around on the I've covered it.
Yeah. So we started obviously talking about patients in the hospital, and then we talked about pets in the home, and then we kind of chatted through your research and a couple of cases to finish off with. So, I mean, it's given me so much food for thought. I do talk about sleep in my consultations, but not nearly enough. I have just realized not nearly enough. So I'm definitely going to be building that in more. And I also love the fact that you're still continuing to go to sort of, human healthcare CPD days on chronic disease and sleep, because I think you're right. There's so much that we can learn. I wonder, is it even possible that to do sleep studies on pets? I've no idea. That's maybe something for the future. Something that you've ever thought about?
Yeah, absolutely. And I think it will come. So we're working with a few different companies, like some of the tracker collars and stuff like that. Quite good movement data, at least about movement. They are understandably not willing to sort of share all of their technology with the wider public. That does just mean that we're in a little bit of a tricky position of trying to work out, say, if you've got a very inhibited or still individual compared to them being asleep, would these trackers kind of pick up on those differences? We're cautiously sort of dipping toes into research with that sort of side of things. Be really, really interesting, and hopefully that'll be published over the next few years. But yeah, there's a huge amount to come, I think, because there's a lot we can extrapolate from the human field. I think the other thing is, when we reverse back to maybe 60s, 70s, 80s, actually a lot of the research that was done for the benefit of humans was done on animal models. So there is that information available. We just often, when we're searching for it, don't use the right terminology because we're not looking into PTSD and REM sleep. And that's the sort of term that we would need to search, for example, to look at the dog models. So it's those sort of things where actually, if we could, and I would love to set aside the time, I'm sort of itching to do it, of doing a deep dive into that sort of literature, to try and really work out, actually, we probably do have some data there that we could delve into. So if anyone is interested in that sort of stuff and wants to have a chat, just get in touch with me. You're very welcome to do so.
Yeah, no, that sounds incredible. Yeah, lots to come. I think this is such an exciting area. And I think it's something that we really don't think about. And I love what you said earlier, Carrie, about, a lot of time people think that the solution to their pet's behavior problem is just more exercise and tire them out, when actually we might be, doing the exact opposite or achieving the exact opposite by creating more emotional arousal, which they're then not able to kind of drain, if you like, because they're not getting enough sleep and rest and downtime. So I love the fact that we're talking about this more. And I think for myself anyway, I love thinking about almost like the therapeutic elements that we can bring into veterinary behavior medicine or veterinary psychiatry, because I think that, that's overlooked so much. People are so keen to do a lot in terms of let's train them, let's teach them. And absolutely, that is, an important element of it. But I think looking at some of these basics and how we can bring in some of those, true behavioral needs, because they're a different species to us. They don't need 8 hours of sleep. As you said, they need 16 to 18 or even more if they're puppies or kittens. So I love this. And I was also so looking forward to this conversation because I knew that this would be so valuable, both for myself, selfishly, but also for everybody listening, because I think there's so much to be taken from this. So thank you so much for sharing your time, your expertise, and your obvious passion for the topic. And yeah, as Carrie said, we're going to be sharing both of her studies in the show notes. And then if anybody wants to get a hold of you, Carrie, how can they get a hold of you? Where's the best place to get a hold of you?
Yeah, so you can do that via my practice, so behavioural referrals, veterinary practice. I'm just having a quick glance at the study to see if the email's on there, but if not, it's Carrie, so CARRIE at brvp.co.uk, so behavioural referrals, veterinary practice.co.uk.
Yeah,
but yeah, I didn't see any else.
It's on the studies. I've just seen it.
Perfect.
Correspondence, exactly that email address.
Yeah.
But I'll put it in the show notes again as well, if that's okay. So people, if they want to contact you for further either interest or collaboration around sleep, they know exactly where to find you.
Absolutely.
Yeah,
I love a team approach. So yeah, absolutely happy for that sort of stuff. That's no problem.
Perfect. Thank you so much. It's been an absolute pleasure as always. And thank you everyone for listening. And I look forward to seeing you in the next episode, which will be episode 88. Wow, I can't believe we're already that far in. But thanks, Carrie. Such a pleasure to have you here, and see you soon.
I appreciate the invite. Thanks for having me.